rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I would like to thank everybody for coming today. I have an announcement. Last meeting, I directed planning codes planning and zoning to come back this month with a plan on how they were going to facilitate moving to like a contract. They've come and asked if they could have another month, so that's why they aren't on the agenda this month. Just letting the board members know, if anybody was paying attention and wondering why they weren't here. Okay, so do we have any additions or changes to the agenda?
We removed the SWOR noncompliance hearing for LeBron Trash.
7B, correct.
Move agenda as amended.
All right, I got a motion and a support. All in favor, signify with aye. Aye. Opposed? All right, moving right on. Approval of the minutes from March 5th. Thank you very much. All right. I got a motion and a second. All in favor, signify with aye. Aye. Opposed? All right. Moving on to public comment. If you would like to make a comment, please come to the podium. Please keep it limited to 3 minutes. Okay, seeing none. Moving on to 6, agency reporting. First up, we have the community mental health.
Good morning. It's been a while since I've been here, and there are some new faces here. So let me introduce myself. I'm Sarah Lurie, Chief Executive Officer of Community Mental Health Authority of Clinton, Eaton, and Ingham counties. And I'd like to share with you some background information about community mental health and about our relationship with the counties, and provide you just with some general updates. So first of all, many of you know that our counties and community mental health organizations are very closely tied together through the Michigan Mental Health Code. And together, we provide a safety net for all of the residents of Eaton County around behavioral health crisis and services. In the Michigan Mental Health Code, it particularly has a focus on assuring a safety net for individuals who are in crisis, individuals with severe persistent mental illness, individuals or youth with a serious emotional disturbance, individuals with intellectual developmental disabilities. And then through our role as now a certified community behavioral health clinic, we've been able to provide services also to the mild and moderate population as well. So I wanted to assure you that we are providing a large amount of service to Eaton County residents. In 2024, we served 2,374 Eaton County residents. That is up about 10.5% from the previous year. We also, one of the supports that we receive from the county is some local funding from each of the counties. And that support is really important in being able to meet a match to draw down the Medicaid funds. So as a result of the funding that we receive, the local funding, we were able to draw down those funds, and we expended $26,663,133 providing services to Eaton County residents. So I wanted to give you an idea of the kind of services that people are receiving in Eaton County. So we provide those services, many of them directly in people's homes through home-based services such as our family guidance intensive service that serves families, youth with serious emotional disturbance. We also provide community living supports in people's homes, which generally are for adults and youth, many of them who have a developmental disability. We also provide support placements in adult foster care settings where people are receiving 24/7 care in those settings. We also authorize and pay for psychiatric hospitalizations, partial hospitalization programs. We operate a number of our own group homes, and we also authorize and pay for autism services, applied behavioral analysis, which is often happening in people's homes or in some center-based programs. We also provide a wide range of outpatient services at various levels of intensity. So generally, if you were to go use your regular services available through a commercial insurance plan, that might cover the basic outpatient visit. What we have are specialized services that can include very intense levels of case management and support. So our highest level of care in the community is our assertive community treatment program, which is a team approach, and they are literally going to people's homes, making sure that they have their medications, are taking their medications, taking people to their appointments, and really providing an intense level of support so that they can continue to have the opportunity and the quality of life in the community. So other areas that we're providing services in Eaton County, we do operate the Eaton County Counseling Center here in Charlotte. That is a very busy place, one of our satellite offices, so it's offering a variety of services. We are fully staffed there right now and generally out of space. The demand is high, and we are putting up temporary space to be able to add staff to continue to see more people in Charlotte. We also operate some services in the jail and the youth facility. We have a adult outpatient program called Waverly Wellness that serves the Delta Township area. We have a youth respite home as well that serves or is located in the Delta Township area. Eaton County residents are also coming into Lansing and receiving services from one of our Lansing programs and facilities. I'll pause now just in case you have any questions about the scope of services that we provide. Psychiatry is another very valuable service, and we are able to provide that directly out of Eaton County Counseling Center. And then we have a large psychiatry clinic in Lansing in our Jolly Road facility as well. Okay, I'll keep going then. So I mentioned to you that as a certified community behavioral health clinic, we have been able to expand our services wider, and in fact, we served in total 14,000 individuals and families, over 14,000 in fiscal year '24. And that's a 7% increase from 2023, but it's about a 20% increase from 2022 or 2021 when we first became part of Michigan's demonstration project. So this really has allowed us to open our doors wider, taking people in with mild to moderate mental health conditions is really preventative from them needing some of those high intense and much more expensive specialty services, particularly things like psychiatric hospitalizations and those kinds of traumatic things for people. So We're very, very pleased that we've been able to expand our services in our way through this demonstration project. So just to give you an idea, we are in the 4th year of that project. It started with 13 original sites. We were one of those. Now it has increased every year, and there are now 36 community mental health and other organizations who are certified as CCBHCs in the state of Michigan. So it is a really solid model with a lot of great outcomes and being adopted much more widely. So CCBHCs are required to provide nine services: psychiatric rehabilitation, peer support, counselor services, family supports, intensive community-based mental health care for individuals of the armed forces and veterans. So we do also have a veterans navigation team that we've been able to offer as part of CCBHC. There's a rigorous set of standards to become certified, and you have to be certified by MDHHS to be part of the project. We've been certified twice under Michigan. Last summer, we were recertified with no provisional certification and no need to do any kinds of corrective action plans. So we were really proud of that. So in order to meet some of the demand of the mild to moderate, we have been trying to find very innovative ways to expand some of our services. Much more demand in that population for evening hours. So we have started what we call community care services, where we're providing some additional evening hours in some of our existing settings. We also started a new pilot program called the Counseling and Support Clinic. It's a unique array of services, and it serves many individuals who have some neurodiversity or cognitive issues that maybe are not severe enough to qualify for the intensive services for individuals with intellectual and developmental disabilities, but they need additional support to navigate some things in their lives. So this clinic combines counseling, it combines some of the expertise of our staff who provide services to those with developmental disabilities around case management and helping to connect with resources. It also combines vocational supports, supported employment opportunities to individuals in that clinic. So, and it has peer support and access to psychiatry. So it's a kind of a unique array of services, but it's really making a difference for many people. So you might be wondering how the demonstration project is funded and how we've been able to expand our services this way. So it does come with what's called a prospective payment under Medicaid. So the payment that we receive is based on actual expenses for the previous years, and it's a daily payment for any individual with a qualifying diagnosis who receives a designated CCBHC service. What's exciting about it is we are 85% funded by Medicaid, the entire public behavioral health system is. And that's great if you're a person enrolled in Medicaid. But we have many people with mental health issues who are not and cannot be enrolled in Medicaid. And they might be individuals who are on insurance plans that only cover the basics, that once a week outpatient therapy or a psychiatric hospitalization, and it does not cover the services they really need. And we also know that it's not always easy to get connected with somebody in private practice or even to navigate that system. So what the payment does that's different than Medicaid is any Medicaid dollars that we don't spend, we have to give back. We get an ample amount of Medicaid, we often don't spend all of the Medicaid that we have. It goes back to the region where there is a shortage of Medicaid, and it's used by some of the other CMHs in our Mid-State Health Network region. What we are always short of is what's called general fund or local dollars. It's those dollars that we use to support people who are uninsured, underinsured, or on a spend down. And a spend down means they have to spend a lot of personal income every month before they qualify for Medicaid. With this PPS 1 payment, if we don't spend it all in 1 year, we are able to keep it as a risk reserve and use it to continue to serve those folks who are uninsured and underinsured in the next year. So that's really an important mechanism and part of that CCBHC model that allows us to more fully serve the community. It's always been difficult. I've been in this role for almost 10 years, and there is always a lot of confusion in our communities, and a lot of times we had to turn people away. Nothing worse when your name is community mental health and you're turning people away, but we used to have to do that because they weren't serious or severe enough yet. So that's among the most painful thing to have to do. Under CCBHC, we do not have to turn people away. We may not be the best provider for them. Maybe they need something different, but we can see them long enough and talk to them long enough to help them get connected to other resources, or we can serve them now in our current programming.
Emergency services that are free 24/7. Are the people you're talking about who can't get the services that need local, I mean, are those people that can go to the emergency clinic, or are their problems much bigger and they need a whole lot of different kind of treatment? Who are you talking about when you're talking about these people that we need the match for?
So the match allows us to draw down Medicaid dollars from the state. And then also as part of the local dollars we receive, kind of separate from that, we use it to serve people who are uninsured, underinsured, but need services or are, coming into crisis services.
Is there a very strong black line between crisis services and other services? I mean, you have a whole lot of different things.
Right. Yes, that's a great question. Thank you for asking that. So we do have our 24/7 crisis services. Anybody can come in if they're experiencing what they consider or others consider a mental health emergency. And right now, the main role of our crisis services is to try to stabilize that situation. And the other part of it is to do what's called a pre-screening for psychiatric hospitalization. So as you can imagine, we get a lot of people who may come in with suicidal ideation or who maybe are dysregulated on their medications and starting to experience some psychosis. We get family conflict and issues with youth. And so our 24/7 is really trying to assess and stabilize and make a determination. Also, does this person need a secure environment? Right now, if somebody needs that kind of secure environment, and of course, if it's an adult, we have the ability to petition, and often we're law enforcement and our officers are bringing people in on a, I'm blanking on what it's called, PRC, yeah, PRT, person requiring treatment. And we are assessing them and at times doing petitions so that they can be held and then hospitalized. So we have kind of a variety of people coming in. The only thing in the toolbox, though, right now is a psychiatric hospital for individuals who need that kind of secured environment. Our crisis services cannot hold people for more than about 23 hours for observation. We don't have a locked facility. And this is why right now people do end up stuck in emergency departments. Emergency departments can detain people, can hold them securely while they await a placement. What we are building right now, and you have a handout, is a new service. as part of a crisis care center. So several years ago, the state of Michigan passed legislation for the creation of crisis stabilization units. It's taken some time to be able to develop those. And we are part of a pilot project, and we are building really a crisis care facility on the former Green Lawn campus of McLaren in the Women's and Children's Building. This will allow us to bring our current 24/7 crisis services and mobile crisis, which is another service we provide where our staff actually go out to somebody in crisis, and add what's called a crisis stabilization unit. That's a unit that will be secured, and it'll allow us to keep people for up to 72 hours where they're getting psychiatry and treatment immediately during that 72-hour period to try to stabilize them, so then we can take advantage of all the other community-based services that we have available and try to avoid getting stuck in an emergency department or having to go through a psychiatric hospital placement. The other challenge we have that is also encouraging us to take this on is that we just have not had enough psychiatric hospital beds in our community. We all know Sparrow is looking to build a large psychiatric facility, and that will be helpful. Right now, we send people far away for hospitalizations. We try to, our first stop is usually Sparrow. So I have to get used to University of Michigan Sparrow. Sparrow, Cedar Creek, and St. John's. But many times they are unable to take people either because they are full or they don't have the staffing to take some of the individuals that maybe we're referring. So we have to send people to Detroit, to Grand Rapids. We've even had to send people to Indiana at times because we cannot find a placement. So this, the Crisis Care Center, we are hoping will keep people in the community closer to home where their family can be part of their treatment and divert from a possible psychiatric hospitalization or a need to leave the community. That's a very long-winded answer to your question. Yeah.
Yes, Commissioner. Yes.
When it opens up, how would we get our people from Eaton County in there to the Green Lawn campus? Would it be like a parent driving someone there, or would we have police?
Yeah, similar to what's happening now, Jeannie, because we are already providing that 24/7 care. So what happens right now is police transport, ambulance transports, family members are driving people in. Sometimes our own staff are bringing people in. And then for people who maybe are violent or the police might think they would not be appropriate to bring to our current setting, they will take them to the emergency department, to one of them.
Thank you.
We have any other questions? Yes, Commissioner.
Mr. Toomey just brought this to my attention. In item number 2, under agency reporting requirements, we have how much funding have you received from Eaton County in the following fiscal years? And in particular, 24-25, it says total $792,914. The Tri-County allocation is $551. So can you explain that?
Yes.
A little more detail, please?
Sure, I'd be happy to. So there is a formula that was passed by resolution across each county commission, Clinton, Eaton, and Ingham counties, many years ago, I think around 2002, that lays out a formula for that local contribution. And it's based on a 3-year average of utilization. So soon, probably in May, we'll be meeting with all of our controllers and talking about that formula and how it shakes out for this year. So that is the local money that helps us get the match to draw down those Medicaid dollars, which again, you contributed last year $551,000. we spent over 26 million on Eaton County residents because we're able to get those Medicaid dollars. The difference between that is there are some programs that are specific to Eaton County that the county helps to fund. And there are programs that we cannot use Medicaid for. Medicaid, again, is wonderful, but you can only use it in certain ways for certain people, and it comes with a giant book of rules. So we need other kinds of funding to do things like provide services in the jail, in the youth center, and then we also provide services for the truancy intervention program. And when we can use Medicaid for the truancy intervention program, we do, but we can't for everybody. Does that make any sense?
Yeah, I mean, the balance of that 792,000 then goes directly where?
To the services that we provide in the jail, in the youth center, and for truancy intervention,
Particular to Eaton County.
particular to Eaton County.
So then that 551,000 divided up between the 3 counties.
That is Eaton County's portion. Ingham County pays more, considerably more, because their utilization is higher. They're a larger county. And Clinton County pays a little less.
All right, thank you.
Yes, Commissioner.
I guess just for my clarity as well, so the 551 is the Medicaid match and the 792, like, so take 792, subtract the 551, and then that number is what we need to supply on top of that to provide services that are do not receive the Medicaid.
Exactly.
Okay, and so 792 is the total amount that we paid into. And then I have a question then relating that number to the back page of the report to the community. Is that 16.6% that I see on there for Eaton County, is that representative of the $792,000 number or the $551,000 number? Is that only including the Medicaid
No,
dollars?
That would represent anybody who we provided services to that were entered. We pulled that from our electronic medical record. So as long as it was somebody who we provided some kind of service to.
Okay, and then when I'm looking down at the general fund revenues down here, and it shows local, 6.1 million, 792,000 is our share of that?
Yes.
Okay, okay. I was just curious, because that looks like we're kicking in then about 12.8% on the local dollars, and we're getting 16.6% of service defined by number of people. So, thank you, I appreciate it.
Yes, Commissioner.
So, I'm kind of blown away that you have a $236 million budget. I had no idea that you were that huge. I mean, could you give us some of that? We need a little bit here.
Yeah, I wish I could, but it's mostly Medicaid. So,
I'm sure we have people. So like, Sarah, how would you kind of broadly break down how that amount of money is spent?
So one thing I want to make people aware of, and I think I did put it in that document. So 51% of the money that we spend, and as I said, we do send money back to the region, Medicaid dollars back to the region, because the funding in the public system it doesn't make sense sometimes. So there are other CMHs who are horribly underfunded with Medicaid dollars. So it's not bad at all that we're sending some of those dollars back. Well, how it breaks down for us is 51% of the dollars that we spend are for services for children and adults with intellectual and developmental disabilities. So you have to keep in mind that many of those individuals require 24/7 care, are very vulnerable, fragile, medically fragile individuals. And so those, and they are Medicaid, often Medicaid recipients. So that is always going to be the folks that we serve that we spend the majority of the funds on. Then after that, we had 20% spent for children and families with serious emotional disturbances. So we hope that spending that money on children is really early intervention, so that then we are not needing also to spend that money on every child that becomes an adult. 29% of the funding is spent on adults with mental illness. So does that help to understand? The other thing I want to say about our budget and those dollars, it does look really big, but a good portion of it is grant funds related to the development of the Crisis Care Center. So we have about 16 million in grants attached to the development of that Crisis Care Center.
Well, and so then the rest of it will come through Medicaid, more or less?
85%. 85% of what we spend is Medicaid.
That's what you can also use to build a center.
No, we can't. So that's why we have the grant funds. We've also bonded some money through Ingham County that will pay back via lease. But when you look at our funding for this year, those grant dollars, last year and this year, those grant dollars inflate what our funding.
So how much more do you need beyond the 16 million to actually be able to finish the center?
So once the center is open and people are utilizing it, then we'll be able to draw on Medicaid and health insurance and those kinds of things.
Thank you.
Sure.
Okay. Any other questions? Oh, yes, Commissioner.
Sarah, do you think that they're going to adjust the Medicaid reimbursement rates? Because I know Medicaid comes through federal dollars and a state dollar formula. I think isn't it 50-50 about?
Well, yes, I mean, we're of course, keeping a close eye on Medicaid right now because we rely so heavily on that funding to serve a lot of people. So some of the things that have been talked about would be work requirements, which will reduce enrollments in Medicaid. We receive a capitation based on how many people are enrolled in Medicaid in Clinton, Eaton, and Ingham counties. So anything that reduces enrollment then reduces funding based on the PEPM. And the other thing that's been talked about is the match. So I'm trying to remember. Right now, I think the Healthy Michigan is probably the most at risk because that's Medicaid expansion and it has a lower match right now required by the state. And if that match changes and the state has to pay a higher match to continue it, then they'll have to make some decisions about it.
And let me be clear. I don't think I'm mistaken in this. Medicaid is one type of qualification. Medicaid expansion is for uninsured but lower paid working people. And in the next thing is the affordable health care, which AKA Obamacare. If your state does not have expanded Medicaid to cover those lower income, those people cannot move up on the computer to affordable health care. So that's why the Medicaid expansion is a big situation being looked at the moment, because we may go back to the era where our lower paid people with needs can't get their needs met, and therefore they end up in the emergency room at the hospitals costing a lot more money than if we treated them on some type of couple time a week visits, someplace at the primary care doctor, the CMH office, the whatever. So all these things that are in play actually have a big effect right down to the local levels.
Absolutely, and there was a time that the public system was not primarily funded by Medicaid. There was a time when the state contributed a lot more, the majority of the funds were general fund dollars, to have that flexibility. But over time, it has become more and more funded through Medicaid. So I have concern that the state will not be in a position to put general funds back into the public system. And then it becomes very difficult to serve people who are uninsured and underinsured, except for that core mandate of crisis and severe persistent mental illness.
All right. Yes, Commissioner.
Budget question for us. So I know that if Eaton County provides, $500,000, I know it was a health department, we have a similar kind of formula that each county, Berry County and Eaton County contribute. Is that something is that a requirement, or is that something that's optional, or how has that worked, or how does that work? If we our portion of the match?
So,
I guess I'm missing Connie more than Sarah.
yeah, the formula that we use, as Sarah said, it was agreed upon. We've gone through a process before where a county has not been able to contribute the percentage that was calculated. That impacts then the formula going through the others. And I know that you obviously know we're having budgetary issues, so that will be an issue this year for all outside agencies. And the same would be true with the health department. We do work under a formula, but it does not require that we supply that amount. But as she said, any cuts that we make impact the services to Eaton County directly.
And in the 10 years I've been here, we haven't adjusted that formula, so it may have happened in the past. But then it does have to be, because it's set by resolution, it does have to be discussed with the other counties.
Okay. Thank you. Good? Okay. Thank you very much.
Thank you.
Next up, we have the landfill report.
Good morning, Chad Powers, Eaton County's Facilities Director. The landfill report falls under my umbrella of duties. Just a little background. The Eaton County operated a landfill back in the early 70s to mid 80s. It's located, it's about 85 acres in Benton Township, about 1.5 miles north of Potterville. And it's between Gresham Highway and Windsor Highway, just east and adjacent to Fox Park. As I mentioned, the landfill was in operation from 1971 and then closed operations in 1986. After a landfill is closed or decommissioned, we're required to make there are certain requirements the state imposes on us to monitor that site. We've been doing that historically for the last 12 years. We do that with the partnership of a third party. So it's a third party monitoring system. And today I have Mike Serafini with Strata. He's going to talk a little bit about what they do and what the requirements are. He's subject matter expert, knows way more about this stuff than I do. So I'm going to turn it over to Mike.
Good morning, everyone. Morning. Anyways, I gave a talk last year, so if any of you were here and it's similar to that, I apologize. Anyways, I'm with Strata Environmental, and what we are is a hydrogeologic consulting firm specializing in the environmental field and groundwater supply. What I do for you is you've got your post-closure monitoring requirements by Eagle on the landfill. So semi-annually, we go out and we collect groundwater samples from all your wells and submit them for the required set of analyses. From there, we get the analyses back and we provide your semi-annual monitoring reports as required to the state of Michigan. Along the way here, when PFAS started becoming a hot button topic around the country, the state started looking at all the old landfills and known sources or potential sources of PFAS. And accordingly, they requested that what would be considered groundwater all flows in a direction, okay? So we have some wells that are hydraulically down gradient or downflow from the landfill. And historically, some of those wells have shown impact from the landfill operation based on the compounds we're detecting. The compounds are nothing that serious, but they do exceed regulatory criteria. Accordingly, the state asked us to sample those wells, the 4 that we have that are hydraulically down gradient that we have seen previous impact in, and then a 5th well, which is down gradient from those that shows no impact, indicating we understand where the groundwater impact is. So they have required us to sample those for PFAS, and lo and behold, some of them have detectable concentrations of PFAS. That also is in the package of reporting you've just received. The concentrations of PFAS at this site are really low and, in my opinion, of no real great concern to the public health and the environment. The concentrations are hovering right around the part per billion or part per trillion concentration, which is ridiculously small. This is the first compound where we have seen detection limits drop to that. We normally work in part per billion or part per million concentrations. And just to give you an idea how small a number we're looking at, a part per million is like a drop of food coloring in a 10-gallon water tank, all right? A part per billion is that same drop of food coloring into a 10,000-gallon swimming pool. And a part per billion is that same, or a part per trillion is that same concentration dropped into, what do they say, 20 Olympic-sized swimming pools. So you can understand what a tiny number we're looking at. Unfortunately, the toxicologic data has taken, we have regulatory criteria on 7 PFAS compounds in the state of Michigan. There are a total of 31 or 32 we look at that the state wants us to look at. My guess is they're collecting the toxicologic data on those compounds still and haven't come up with a justification for regulatory numbers. But regardless of that, your compounds are hovering right around that 1 part or 2 part per trillion detection limit. But one of them happens to exceed a cleanup criteria of, I believe it's 4 part per trillion. So they're ridiculously small numbers, but they show up and they don't meet the regulatory number. As far as impact to the community, these things are hydraulically down gradient from all the residences, and everything is flowing towards Fox Park with plenty of space in between. Nothing is pumped out of the aquifer or any of the water supply wells could never draw enough water to change the hydraulics of everything out there to draw those compounds back to their wells. So what I'm telling you is what you're monitoring is a regulatory issue and not really anything that's of any overall concern to the public health and safety. And I'm ready to take questions now. Oh, one more thing I wanted to let you know, and as part of this, you've got this monitoring well network, and we have spent the last 3 or 4 years. The wells have a life expectancy, and we have been replacing your wells on a yearly basis to get them. They were producing questionable data and stuff. They had lived their lifetime. So we've replaced the wells. All of them are done. We're not replacing anymore. We're back to just strictly monitoring at this site. And I think you'll get a long life out of the new wells I've put in. Now I'll take questions. So go ahead, please, whoever.
Yes, Commissioner.
Okay, so I have a few questions.
Sure.
So one of the, so this monitoring, has it shown any like spread? Is it moving at all in terms of the
It
contamination?
looks pretty stable to me.
Okay, because you say that, so only one of the wells tested exceeds regulatory limits?
On the PFAS, I
Yeah.
can't remember if only one does. I'd have to look back at the data.
Okay, because, I mean, if it exceeds regulatory limits, I mean, you've said that it's not that serious, but isn't PFAS known to cause like cancer and other
Sure,
issues?
sure. Yeah, that's why they've set those limits and their exposure assumptions into it. Yes, correct.
And we're exceeding those at the sites tested?
Barely, yes,
Okay.
correct. But from the scheme of things, there's no way it's going to, it can't impact your local water wells because there's nothing in the path of its migration. And at those concentrations, it's going to naturally attenuate. And in this case, what that means, it's going to dilute and you'll never see it. That's why we haven't seen it in the down gradient wells, the most down gradient well. So we do not see it there. And everything is just tied to that little area down gradient from the landfill.
Okay, I'll pass it to other commissioners.
Yes, Commissioner.
Okay. So I was on Board of Health for 6 years. However, I didn't really get into the type of wells. So that's not at all my background. So when you talk hydraulic wells, what I learned from being on Public Works years ago was that we were cutting down trees that went through the tap and different things like that.
Yes.
But the hydraulic wells, are they around the outside?
Yes.
Why are they there?
The wells,
Yeah.
they were required as part of your operation and monitoring. I can tell it's all public record. I do all Granger landfills, monitoring all their well work and everything else. And as part of their operation, there are requirements in their permits that they have to have so many wells. As the landfill expands, you need so many up gradient, you need so many side gradient, being that, all right, water flows this way. You need them before the landfill so you can understand what water chemistry is coming at your landfill. You want it on the sides of the landfill, and then you want it down gradient from the landfill. And that's how you evaluate impact. If you get certain compounds in the groundwater that are not naturally occurring, let's say benzene, or for example, a solvent, tetrachloroethylene, which is dry cleaning solvent. You see that there. That's impact from the landfill. They're not naturally occurring. But now when you're dealing with dissolved metals, which we look at, you're looking at sodium's a metal, phosphorus, you're looking at all these inorganic parameters, most of which are naturally occurring. The difference here is it all comes down to a variation then from your up gradient. If you see a significant increase in a specific compound, hydraulically down gradient from the landfill versus your up gradient and side gradient stuff, well, then that leads to suspicion that that is a contribution from the old landfill. And that is the concept of why they went in and what we do with that data.
Okay, so that's why you have to have those certain type of hydraulic.
Yeah, they're
wells.
just
So you-
2-inch wells set into the first groundwater bearing unit.
Okay,
All right, and then the hydraulics are based. What we do is we space out these wells. Well, we knew which way flow was anyways. You start any site off with 3 wells, right? Get their elevations of the wells, measure your depth of groundwater. Then you can make that an elevation. And then you've got 3 points, and with 3 points, you plot it up and you can form a plane. And then down dip on that plane is your flow direction, all right? And then based on that, we then design the placement of our other wells. But they're just 2-inch wells with 5 foot of well screen set into your first water bearing unit at the site.
okay, so this doesn't have any issues for the people who have residents over on Windsor or anything like that?
No. First of all the houses anywhere there are on the up gradient side
Okay.
or side
That's why
gradient
it's running
side.
towards Fox.
And it's going towards Fox Parks, and you have nothing for that. I mean, and it'll, like I said, the closest down gradient well from our known wells of, I would call minor impact, we've never seen anything at it, so.
Okay.
And that's what the purpose of that well is. That's what we refer to when you've got everything defined on a site, or you've got your monitoring network in. The one you place furthest down gradient from either a known source or a known area of impact, that is clean, all right? Once you get a clean point, that is used as what's called a sentinel monitoring well. When things show up in a sentinel monitoring well, then you have to make decisions on, do you need a further monitor well down gradient, or is it a critical issue that we have to treat, start cleaning up, start recovering? None of these apply here, nor would you ever employ them. The concentrations are so low. That's why you're getting no pressure to do anything about it. It's contained, it's on your property. With that being on your property, it puts you in the driver's seat. Okay, when it migrates off your property, you don't have as much control then as to what happens down the road. But as of right now, there's nothing. I don't see any way this could even be close to a threat to the,
So we have residential homes too on Gresham.
Yep.
So if the water is not bothering the people on Windsor, you have the landfill, and it's slated towards Fox Park. We're not concerned with anybody either on Gresham, right?
No, that's so far
That's so
away,
far
and
away.
you've got, I mean, basically, let's say you're looking at our down gradient PFAS well, 4 parts per trillion. That's 4 drops of food color in 20 Olympic swimming pools.
Oh, yeah, okay.
That concentration moves, it'll just dilute in the groundwater. That's what it does.
So with the people in the old days up to 1986, did they actually go to the landfill off of Windsor?
This all predates me.
Oh.
So I'm sorry
I don't
about
know.
that. It looks like that was the route. That's the only route that could have been in there.
Okay.
All right, there are no other roads. So, and based on the fencing and everything, yeah, I think they had the entrance off of Windsor, and they had a gatehouse there before you went into the main landfill unit.
Okay. Thank you.
Yes, Commissioner.
Thank you, Mr. Chair. There's 4 ponds in the area of Fox Park, 3 of which are on the park property. and
Correct,
There's a
yes.
drainage ditch to the north. Have those surface waters been tested?
No, they haven't, and there's really no reason to justify. We do pick up periodically, right around detection limits. So I'm talking around a 1 or 5 part per billion concentration. We'll pick up some volatile organic compounds in the surface water that flows down by the landfill, and that's just an interception of shallow groundwater. That's all that is an expression of the shallow groundwater, because some of the wells there, water's only 2 foot below ground level. Same thing, they're right at detection limit. By the time it travels that long, you'll never see it, and it auto breaks down. Most of your organic compounds will break down through water movement and aerobic degradation.
I'm assuming, and I don't know that you'll know this answer, but I'm assuming that basin for the landfill was constructed specifically for landfill, so there's some kind of clay liner in it?
All unknown to me. What I do know is I don't believe you have a leachate collection system on it, all right? And if you did, nothing's done about your leachate. So it does build up, and it does break out at the surface on parts of the landfill. We have tried to address it in the past with some less expensive Band-Aids, but with no success.
Thank you.
And we may plug it one spot, and then the pressure builds up and it wants to weep out somewhere else, but we have not seen any impact associated with that, but I know the state frowns upon that. All right,
Okay.
anyone else?
All right, thank you.
All right, thank you. You all have a good day.
All right, moving on to number 7, reports, excuse me, the Department of Implementation Agencies.
Good morning, everyone.
Morning.
General updates. The Department of Resource Recovery has opened our registration. We're developing the materials management plan, scheduling education events, and we're expanding recycling opportunities in the county. And as SWOL and SWOR, our solid waste ordinance licensing and reporting, we have, again, a total of 9 licenses issued. There was going to be a violation hearing for the solid waste ordinance reporting. And since I submitted the agenda, LeBron Trash Hauling LLC is now in compliance with our reporting requirements. So we will not be needing a hearing today. Our county projects, our events are on their way. Most recently, we met with Communications Director Logan Bailey to discuss outreach and advertising strategy for the events. Currently, the department, since I submitted this report, we actually have over 300 registrations and about 100 for spring cleanup and 80 for Recycle-Palooza. We'll be working with Logan Bailey on print advertising in April through the County Journal, and we're also going to be advertising through our local recycling centers, municipal offices, and putting up flyers around town. Our first event is in Delta Township, and our second event is in Charlotte. And so for this event, we migrated our event management systems over to the website. And with the data we're able to get from that, from our registrations, we're gonna be able to be more targeted with our outreach. So with the first event being in Delta Township, for example, we wanna target much of the North County. So everywhere from Delta Township all the way to Sunfield and even going south down to Powderville. So we're gonna be focusing our efforts in the next month in the north part of the county, and then later on for Recycle-Palooza in August, which is centrally located in Charlotte. We'll just have a more general marketing and outreach effort there. And the Eagles Scrap Tire Grant was released, and the department did apply for it, and we are waiting to hear back from Eagle on whether or not we approved and receiving the grant contract, the grant agreement. Our local projects, or the solid waste alternatives grants, are moving forward. And our mobile recycling program, our Eagle Infrastructure Grant, we're continuing to operate in the communities of Vermontville and Bellevue Olivet. We are having a slight change starting in April 2025. So starting this month, we will be in Eaton Rapids every Monday from 2 to 6. We've been working with the city of Eaton Rapids to come up with more opportunities for the residents there to recycle. So we're really happy about that and working with Eaton Rapids. And hub and spoke development, we're continuing to take materials. Our material growth is actually pretty significant, and from our material sales, we are increasing our revenue year over year and even month over month. So I've seen a lot of really great growth in our materials, and the sales of our materials, because we're doing source separating, our purchasers, the manufacturers that purchase our materials, are very happy with the quality, and so are we. For education, we're still actively planning education events for the 2025 season. So in addition to the parks, Eaton County Parks, City of Charlotte, school districts and libraries, and the Conservation District. Something that the department is doing, we have our annual Michigan Recycling Coalition. The Michigan Recycling Coalition is a nonprofit that represents a lot of the Michigan recycling groups, including county groups. And so we will be attending that conference in the next month, as well as looking at the Michigan Healthy Climate Conference in April. The material management plan, we do have an action item. We met on Tuesday, March 11th, and we finally reviewed all of our bylaws, and we were able to pass our bylaws. And so the department is requesting the MMPC bylaws be approved by the Public Works and Planning Committee to move to the full board for a vote. The next MMPC meeting will be on Tuesday. This is a typo. Tuesday, April 8th. I apologize for that. And we're going to be covering the work program. And the work program is what Eagle said is our grant application. So once we approve the work program, so all it is a list of tasks and benchmarks that we want to reach in the next year. Once that gets approved by the Materials Management Planning Committee, it'll move to Public Works and Planning, and then to the full board for a vote as the county approval agency. Once it's approved by the full board, it'll go to Eagle for approval, where the department will have access up to $108,000 in grant funds to develop the new solid waste plan for Eaton County. And that is my report.
I got a question.
Yes.
These events that you're getting ready to hold, you know, the one in Delta and then the one in Charlotte, are you going to be taking, you know, those odd things like batteries or, you know, TVs, or is that, because I know in the past, the county is, I don't even know what I think it's a hazardous waste recycling day or something like that, or?
Yep. Yes, and I have flyers, if I could pass them around for the commissioners, if they'd like to see them.
Did any other
Yes,
commissioner-
the focus of our recycling events, a lot of recycling, we do have in more populated areas, for example, at Home Depot, Lowe's, Meijer, Walmart, they do have opportunities to recycle light bulbs and medications, plastic bags. And what our department really focuses on is the hard to recycle and hard to get rid of and manage materials. And so at our events, we really focus on electronics and household hazardous waste because usually there's a large cost associated with disposing of these properly. So as part of the solid waste ordinance of 1993, the county holds events throughout the year in order to collect these from Eaton County residents free of charge. We do have suggested donations, and the community's been very kind, helping offset some of the costs, especially of the electronics recycling. Also included in our events are scrap tires. It being in a farming community, we have a lot of tires in the county, and so we're really proud of our scrap tire program, where we fill up to 2 52-foot trailers full of tires, scrap tires, twice a year for county residents. So, and additionally, we were contacted by the Charlotte Lions Club, and we are going to be taking eyeglasses also at the events with a partnership through the Charlotte Lions Club.
Yes, Commissioner.
Thank you. So the paper that you just passed out is the Delta date.
Correct.
I see that the August 8th is the Charlotte date. Same times?
August 9th, yep.
Or August 9th, I'm sorry.
Yep, 9 a.m. to 2 p.m., correct.
Okay. And where is that exact location going to be? Have they said that yet?
Our department has a policy of not disclosing the location unless people are registered.
Registered, okay.
Yep,
Okay,
but it
I
will be
understand.
in the Charlotte area. And the reason we do registrations is to smooth out the process for not only our vendors, but also if you drive up to a recycling event and there's a mile of cars, I think a lot of people might turn around. So we do on our registration have appointment times to keep the flow nice, and not disclosing the location helps with that, people showing up.
Nope, I understand.
Register.
So one last thing,
Yep.
then, it's not just Charlotte residents, so that people are clear on that. It
Correct.
can be Bellevue, Olivet,
Yes.
you know, Potterville, whatever, whoever's around the area,
Yep.
as long as
and
they register.
As long as they register, anyone from the county can attend these events.
Okay, perfect, thank you.
All right. Yes, Commissioner.
I've already registered for I've already registered for the Delta location, and I just want people to know that registration went really easily using the internet, and you got to pick your own time. And there was a spot if you had questions, and I did have a question, so your staff person called me right back like within 2 days.
Great.
Answered, so it worked out very nicely. And the other one is on the scrap tires. Years ago, we went to some new compensation of asphalt, which also included ground up tires and things like that for rubber. Are they still doing that for resurfacing asphalt with those tires?
I'm unsure if our specific program with Eagle will go to the asphalt programs, but once the tires are with our vendor, they go
Oh,
to where
wait.
the vendor, yeah.
Because
It makes-
the one thing was when they went to trying that, you know, for a recycle situation, the roads are a little bit noisier.
Oh, really?
Okay, but, so I just didn't know. I was just asking you because you have the tires listed. Thank you.
No other questions. Do you want to speak on any of your bylaws before we move it, or is there anything you would like to highlight in there, or are you satisfied?
No, I'm satisfied with the bylaws. We had intense debates about some of the bylaws, but I'm happy with what our results are.
Okay. All right, so I need somebody to move so we can vote on the bylaws. I got a motion. Do I have a second? Second. Oh, well, thank you. Second? Almost like an auction around here, huh? All right, so all in favor, signify with aye. And then all opposed? All right, thank you.
All right, thank you.
All right, moving on to number 8, Parks and Rec.
Morning, everyone. All right, so just as always, I'll just give you guys a brief update of parks, see what's going on. So current events that we got happening right now. As status quo over the past several months, we are continuing our renovation efforts of Lincoln Brick Park at the Interpretive Center. And then some exciting news. Yesterday was the deadline to submit our DNR grant. So we successfully submitted our application. So it's now in the hands with the DNR, and next step will be several months down the road here, but we'll get kind of a preliminary score on how our application is doing, and for the month of September, have a chance to enter any changes that we might have that they notify that we need to have some different numbers, or if any more details they would like, and then final applications will be due October 1st. But right now, application submitted, and now the DNR is reviewing all the applications. We are also continuing to move forward with the Phase 1 projects at Crandall Park for the main entrance, getting information on the wetland area, and potentially going out for bid to get the wetland delineation completed. We also opened up summer camp officially yesterday at midnight, And pleased to say, at 12:30 PM yesterday, we are completely full. First registration came through at 12:02 in the morning, so people were waiting for the deadline there to open up. And then also, starting yesterday, we lifted the catch and release regulations at Crandall Lake, so now it is catch and harvest. Everything is in following the rules and regulations of the DNR with size and time of year that you can catch and keep the fish. So we will work on getting improved signage and everything out there for the public. And then something that's not on the list but also current, our community grant program. Applications were sent out to all townships, cities, and villages March 1st, and their deadline is April 18th. So we did follow-up calls. Everybody has received it. So hopefully we'll get a few applications turned in soon. We'll start the review process there. For our future events and projects, current programming, we have our ABNL, which is the Annie Big Nature Lessons out at Lincoln Brick Park. They were out there pretty much every week of March. We're off this week, but we will be having schools out there again for the rest of the month. We are having a spring egg hunt at Fitzgerald Park, Lincoln Brick Park, Crandall Park, and Fox Park. We were going to go hide the eggs today, but I think we're going to postpone that until tomorrow because the eggs will not be able to be found ever if we go out there today. So we're going to do a couple rounds of that, first round next week, and then a second round the week after on the 14th. Similar to the Christmas ornament hunt, just to get people out in the parks. We do have little prizes in each of the eggs that we bought, so if kids find the eggs, they will have like a little reward for them. Our Enchanted Weekend will be in May 17th and 18th. Car show, second Saturday in July. This year will be July 12th. And our summer camp runs from the second week of June to about the second week of August. Some other news for the Nature Center and the dock down by the Nature Center over at Fitzgerald Park. We have reallocated some funds, so now we have enough to cover the project. And I'll kind of jump ahead to the next item. For the status of that project, consumers will be disconnecting the power to that Nature Center on April 14th. And once that is completed, we will be doing we can go forth with the demolition. We are currently receiving quotes to have the main driveways and parking lots at Lincoln Brick, Fitzgerald, and Fox Park paved. So we had one company came out last week, McKerney Asphalt, and I met with Capital City yesterday. So they will be getting us their quotes, so we have a ballpark idea of how much it would possibly cost us in the next couple of weeks. The Fitzgerald Staircase, we have a pre-bid meeting scheduled for April 9th at 10 a.m. at Fitzgerald Park. And then bid proposals will be due by the end of the month. So hopefully we'll be getting that going as soon as possible. And with the lifting of the catch and release program, we've been working with the DNR on getting some walleye stocked into Crandall Lake. So that is currently receiving quotes from a few hatcheries, and the DNR is seeing if their request of doing a small stocking of 400 fish would be something that they can raise in their ponds, because they did lose a pond last year for their breeding process, so they're trying to get that back. So they told us that we can reach out to some private hatcheries, and roughly it's about $5 a fish, and the recommended amount is per 100 acres, so 4 fish per acre is what the DNR suggests for a small stocking, so we're looking about 400 fish. So one of the hatcheries that have received a quote said that with the amount that we're asking, they could sell us the fish at $3.50 a fish. So still receiving a few more quotes before we make a decision on who we're going to go with. For operations, our seasonal operation positions, we've had about 32 applications submitted so far. We've hired 3 as of April 1st. We have 5 more starting in May, obviously due to school schedules and stuff like that. And we have 2 more interviews to do this summer, or this month, I'm sorry. For our maintenance operations, we have all of our equipment prepped and ready to go for the spring season, especially now with these storms coming through. We just have a lot of branches and trees that we're clearing up and limbing up. And we're also doing second water testing at Lincoln Brick, Fox, and the Dwayne Terrell Roadside Park, just to make sure our levels are safe. And at Fox Park, we will chlorinate the well mid-April, and that's usually when we start to dewinterize or start to open up our bathrooms and stuff for the upcoming spring season. So usually mid-April is the kind of rule of thumb that when we start that process. For, again, the Nature Center demo, we've kind of gone over that with power being cut off on the 14th and demolition being able to start as soon as we're done with that. And also, in case you guys are wondering, there is a dock when we put this here. I'm not saying the bridge that goes across the Nature Center, but down by the dam, there is a dock that's kind of behind the wastewater treatment facility there. It's old, it's just a hazard for people to walk on, so that is what's being removed as well in part of that project. And then again, Fitzgerald Stairs, pre-bid meeting next week, and then bids, proposals are due by the 25th of this month. So, and after that, we can hire someone to build it. And that is my report in a nutshell.
Questions? Yes, Commissioner.
Hey,
I have a couple of bullet points here that the health department came, Colette Scringer, and she said she was testing the water at Fox Park, which we typically do. Now, you just mentioned that you're testing the water at Lincoln Brick, Fox, and Crandall. What's the difference of what the health department is doing and you are doing?
so that is something that I would ask that we probably talk offline for when Chad's here, and Ben, our maintenance supervisor, that we can kind of go into more details with that, because I know that we're chlorinating the well water that we use for our water fountains and stuff like that. But for the exact locations of the spots being tested, that is stuff that, when I saw this report, and I did not realize that is something that we did at our park, so I'm just learning that as well. So,
Okay, because
I can get more information and fill you in.
we do it with a contract with the health department for Fox Park, and I asked her if we were doing any others, and she said, no, we just have a contract at Fox. But we've had that for years, like decades. So that surprised me, but that's okay, we can talk later. Then the other one, I want you to know, it's already going around on Facebook about the art, we're now calling it the art show. Will be at Fitzgerald Park, and it's August 2nd, and it's on my planner. And we used to have it called the Island Art Fair in Grand Ledge. So is Grand Ledge and Eaton County Parks, are they partnering? Last year they had to do it because we had some type of construction going on, so they moved it to the park. And so now it looks like it's going to stay at the park, which of course a lot of us were commenting how well we liked it much better at the park.
Yeah, so that is an event that is hosted by the city of Grand Ledge, and we are just giving them the location. So in partnering, we'll just make sure the park is clean and ready to go to host an event, but all details for running the event, that is done by the city.
Okay, so we aren't charging them then for that or anything, but.
Nope.
So I just want you to know, the parking was so much better by using it at Fitzgerald Park in the way that people could walk around and things. It was just much nicer after 30 years of being on the island.
Well, I'm excited to be a part of it.
Okay, great.
All right. Yes, Commissioner Gross.
Thank you, Mr. Chair. Good morning, Alex. Thank you for your report. I was approached by a group about placing a bench at Crandall Park. Where can we find that criteria for placing a bench, the cost, all that stuff?
I would say just, if you can give me their contact information, we'll reach out to them and see what company they want to go through, and we'll work through their third-party company about location and cost and all that, and make sure the details are squared away.
Well, I was of the understanding that we had a company we're dealing with to get benches out there. That's not the case?
So this would be the first bench that I've been a part of since
Okay.
holding this position that wants to be installed, so I'll have to look in to see who we've used in the past, and if it's someone that they're already going through, or we can recommend, and I'll figure out the details for that. So yeah, definitely reach out to me and give me the information, and I'll go from there.
All right, thank you.
All right. All right, seeing no other.
We got one more.
Oh, yeah. Yes, Commissioner.
Thank you. Sorry, I was a little slow on the draw there. So on this staircase project, for example, I just have like a general question. What's the bid criteria for that? How is that evaluated?
So the bid criteria really is just, we already had the design proposals completed. So now it's just the construction companies coming out to telling us pretty much how much it would cost for them to come and build a staircase.
I guess, I'm sorry, like the evaluation criteria. So when we receive bids, how do you evaluate who's going to build that project?
Well, since the engineering part is already completed, we're just looking at price tag to see, how much is it gonna cost to have them build it for us. So at this point, it's not like they're gonna put any extra design efforts into it. It's more of, this is the material we use, this is how much it's gonna cost. And really the timeline as well. If people say like, hey, we'll do it, but we can't get to it for 3 months, and we have 2 other companies that can do it next month, and we want it done sooner than later, because it's been out of commission now for over a year, so.
Okay, and
We got
is that just
timeline
more
and
of
price
a,
tag.
is that like a subjective decision just based on, this can be done faster and for relatively the same price, or is that something that's actually laid out in terms of an evaluation, like point
I'd
system?
say at this point, it's probably more subjective with the companies that submit the bids. Like I said, it's, and also past history. Chad, he had to step out, but he'll be kind of overseeing the main point of the contractors that come and say if we have history with them, the quality of their work, and stuff like that. So we'll rely heavily on Chad's expertise in this realm as well, but mainly I would say subjective based on timeline and cost.
Okay, thank you. And Connie, do we have a countywide bid evaluation purchasing policy?
We have a purchasing policy, but that is something that needs to be updated.
Okay, let's talk more about that eventually. Appreciate it. Thank you.
Okay. Yep, thank you very much.
Yes.
All right, so we're moving.
Yeah, the other piece on the agenda under Parks is an amendment to the Eaton County Community Grant Program from the City of Eaton Rapids. They were awarded a community grant last year for an acquisition grant, and the purchase did not work quite as they had planned, which is outlined in your packet. And so they're asking to amend that. The city manager is here today as long as her staff, so Yvonne Ridge and Leroy Hummel and Corey Cagle, if you have any questions or would like them to address the request at all.
Well, I'd like, if the city representative would like to come to the stand and see.
So do you want just an overview?
If you could just broad brush, and then we'll see if we have any questions.
Okay, well, originally, when we submitted the grant, we were hopeful to purchase the entire property. We have some issues with the previous owner, and he would not negotiate with the city of Eaton Rapids. I won't go into what those details are. But there was another, Century Construction actually put a bid in for the property, and they purchased the property. I reached out to Century Construction to see if they'd be willing to sell us the majority of the land and part of the property so we could still move forward with our project. And they were much in favor of that proposal. So we have been working in that direction. It looks like everything's falling into place, but we felt like because we had asked to purchase the whole property and now we're only purchasing part of the property, that we should ask for an amendment to that grant before we move forward. So originally, the property was around 40,000 square feet. We'd be purchasing about 10,000 square feet of the building, which would include the gymnasium, which is much needed for our recreation programming. And then the rest of it would be an office space and then meeting rooms that we can use for other activities. It also includes the front part of the property, which it used to be our sledding hill that we've lost for several years, so the sledding hill would come back to the community. And in addition, Oak Ridge Park sits behind that property. It's 32 acres of our park. We have around 10 parking spots right now. In the parking lot, we would own the entire parking lot to be able to have that trailhead be open to the public. And then we also would have the drive going in. So we think it's a good partnership with the company, with this construction company. They are planning on putting in 29 apartments in the rest of that building.
Do we have, yes, Commissioner?
Thank you. So basically, the apartment units are going to be, pretty adjacent to whatever part that the Eaton Rapids will now own?
Yeah, and you have a map
Yeah, I have that right.
that's in there. So within the red is that whole front part of the property is what the city would own. And then the rest of it go all the way around the building. It's all gonna be outside entrance. So there won't be a hallway to go to your apartment. It's all gonna be outside entrances for them to go to. And they'll go the whole way around the building.
Okay. And then, do we need to amend, like, the timeline to spend the grant money, or are we just amending what it's approved to be spent on?
We're only requesting to be able to purchase part of the building. We have no reason, I mean, if you approve it, then we can go forward with our purchase, and we think that'll be done by June.
Okay, thank you.
You're welcome.
So then that part there that I'm seeing that's the building, you're gonna use that because it's the gym, right?
That, the white piece that's right there, yes.
Okay,
That's the gymnasium.
okay. And then, so all the black rooftops there, then, that I see that they're gonna make apartments? Is that right?
Within the red line will be the city,
Okay.
and it's outside of the red is where there'll be apartments all the way around.
How many units do you think you're gonna have then?
There's 29 units. There's going to be 5 one-bedroom, 13 two-bedroom, 10 three-bedroom, and 1 four-bedroom.
Wow, they're gonna build 3-bedroom ones.
Yeah,
We're really short on that.
we're pretty excited about the whole project. I think it ended up being a perfect fit for our community. Adds additional housing, adds, value,
Yes.
to the building, so it increases our tax base, but it gives us also a community center, and it's adjacent to our park. It just is a perfect opportunity, and I think the community is the most excited about the sledding hill.
Yes. So are they gonna have obviously, if you're building 3-bedroom apartments, you're probably gonna have little people. So you're gonna be having playgrounds in that area as well? So the kids can go outside of their apartment and go play?
I don't know if there's any playgrounds out there. Corey, do you know? There's not anything that's there right now. Oak Ridge Park has there's a little bit of open space there. They've looked at doing some programming there, but they haven't been successful in receiving any grant dollars to help with that project. Eventually, yes, we would like to have something else.
We'll go find some money from Mishta. No, seriously, because they're building a nice playground in the back of, remember the school that they're rehabbing over in Lansing on, Cedar Street, the old Walter French?
Oh,
They
yeah.
got a really nice playground going in back there, so,
Yeah, they got a huge grant to do that project. I think they got some appropriation money as well.
yeah, it was Emma.
Yeah.
So I just was in a meeting with them, and I made sure that they were building a nice playground.
Yep.
Okay,
There's room to do that, so
okay. Thank you.
you're welcome.
Do any other commissioners have any questions? Yes, Commissioner.
Good morning. What was the total amount for the grant request previous?
We requested $400,000 for the grant. We were granted $190,000.
Okay. And so you want to retain that amount for the request, correct?
That is correct.
And the previous request was for that entire school property
Yeah, at $685,000.
with the same amount of acreage or increased acreage?
The total was 15 acres. We'd be purchasing about 10 and a half of those 15 acres.
Wouldn't it be prudent to just submit a new request with the amendments on it?
You mean a new application?
New application.
They were already approved for the one they have, that's why they're just asking to amend it.
Right, well, I understand that.
Because they'd go back through the whole application process, and then they may not be awarded again.
All right. Okay, thank you.
All right. Do I have any other questions? Okay, so do I have a motion to approve the amendment? All right, I got a motion. And I got a second. All right, so I got a move and a support, and all in favor, signify with aye. Aye? Opposed? Okay.
Just one more item for the Parks Department is a request to put in a budget amendment to Ways and Means for not to exceed $8,000 for a new sign at Crandall Park to address fishing and some informational purposes now that fishing's available out there. And once we get a firm quote from a hatchery on stocking fish, to stock the fish. So not to exceed $8,000 to do those two things.
Shouldn't that have been a adjustment to the agenda at the prior of the meeting?
No, it's just under the Parks report. We had the work group meeting
Okay.
Monday, so it
But
can
we're
just be
gonna
an
have to
action item
approve
under the
that.
Parks report.
We're gonna have to approve that to go to the Ways and Means,
Correct.
Yep.
so it should have been an agenda item.
Ways and Means is the final authority on it, but yeah.
So, but I'm just clearing the air here. I mean, we gotta approve it to go to the Ways and Means. It means it should have been on the agenda this month. So since it's not on the agenda, it's not going to the Ways and Means.
Okay, we can put it
That's
on the
way it
agenda for
works,
next month.
right? We had an opportunity at the beginning of the meeting in which to adjust the agenda. There was no amendments to the agenda stated at that time. So, yes, Commissioner.
You know, I guess I'd just like to say too that the purpose of this committee is to approve things on a policy basis sent to Ways and Means for budgetary. I'm personally okay with approving it to go to Ways and Means, but I will leave that.
Yeah, you're not the chair.
Nope, I am not.
No, I know. That's all I'm just saying.
Okay.
Yeah. Okay, moving on. Number 9, construction codes.
Morning, everyone. Wanted to let you know that the planning commission met last night and they did approve all 3 of the PA 116 applications. We are picking up on permits, but we're still down compared to end of March. If I compare last year and this year, we're still down. That's not surprising to me at this point. And I think the only other thing that I have is the resolution for the intergovernmental agreement with the city of Grand Ledge to take over all of their permitting, plan reviewing, and inspections, which I believe you guys all have a copy of.
Yep.
Other than that, if you guys can push that on through, I would appreciate it. It has gone in front of our attorney. He has looked it over and approved it. City of Grand Ledge is okay with where we're at with the agreement too, so.
With that additional workload, I mean, you're gonna be able to,
Yeah. Yep, it shouldn't be a problem at all. In losing Windsor Township as of January, it's probably gonna be a 1-for-1 approximate replacement. So, yeah, I'm not concerned about it at all with the staff that I have, the inspectors and stuff that I have today.
Okay.
I did speak with my plumbing and mechanical inspector, because right now they only work on Tuesdays and Thursdays, you know, and if it comes down to it, they both said they could add a day or 2 if they needed to. So, yeah.
yes, Commissioner.
I'm just wondering with, with the budget and the millage and staffing planning, is this something that we're gonna have the capacity to do? It seems like that's an elephant in the room.
So if you remember, this department is funded through its own revenue. So construction code is funded, and this would be funded through revenue. Yes.
Yes, yes.
Thank you, Mr. Chair. Hey, Chris, so this would be over and above the original agreement for just the new construction of the water treatment facility?
Yeah, it would. In our beginning conversations with the city, they really wanted us to do the wastewater treatment plant, which we are in the middle of doing the plan review for that right now in my office. Their thought process, I think, in the beginning was to do that, kind of see how things went, and the expectation was for us to do the whole, everything for the city by late summer, or early fall, late summer, early fall. once they told the people, the contractor that was doing their permitting and inspecting now that we were gonna do the wastewater treatment plant, they chose to end their arrangement with them sooner rather than later. So that's when we began having conversations about doing all the permitting and plan review and inspecting.
All right, thank you.
Yep.
Do we have any other questions from the commissioners? I'm just waiting to see. You were a little slow earlier, so, okay. All right, so what's on the floor is the resolution to approve the intergovernment service agreement with the city of Grand Ledge and the Construction Codes Department. Do I have a motion? I have a motion. Do I have a second? And I got a support. Do we need, since the resolution, do we need a roll call or? No. Okay, all right. Then all in favor, signify with aye. Aye. Opposed? All right, there you go.
All right, thank you. That's all I have.
Thank you. All right, moving on to community development and veteran services.
There is a resolution in the packet to apply for a grant to the Michigan Veteran Service Affairs Agency. It's a grant we've had before. I spoke about it last month. They did the recalculation and lowered the amount of the grant. We use it for a part-time staff and for some financial services for veterans, grocery cards, dental work, co-pays at the MVAA. The amount we are allowed to apply for per their calculation is $63,635. So the resolution would be not to exceed that amount. And the resolution also has a provision in it that the Board of Commissioners has the ability to approve or accept or deny the grant if it is awarded. So if it is awarded, it will come back to the board and you will have an opportunity whether to accept it at that time.
All right, I got a motion and support. All in favor, signify with aye. Aye. Opposed? All right, that carries. All right, so we're on to 11, the juvenile millage budget discussion.
Okay, so in the past, we have had juvenile millage programs that are outside agencies providing services. Last year, the only services we were able to provide were the TIP programs, which is the Truancy Intervention Program, which is operated by CMH, a part of it, and then the other by Eaton Resa. My recommendation would be to maintain those programs, which were, Judge Pollard was here last year and discussed the fact that we need the programs under the new guidelines at the state level. So we would keep those within the juvenile millage and not put out an RFP for any other services and use the juvenile millage to fund the prevention services that are in the youth facility right now. Yes.
Oh, yes, yes, Commissioner.
So Connie, sometime have them come over here and talk to us about the funds that we're giving to the youth facility, so we know where the money's going.
Yes.
Could they spend it all last year that we allocated to them from the juvenile justice millage?
So what we did last year, for this year, we did not put any money from the general fund, and we're using the juvenile millage funding. So yes, they're using all of the funding for the services they provide. Day treatment, CBT is the other community-based treatment, which they just reopened now. But all the funding was used for the youth facility programs that are prevention.
Okay, because we want to make sure the way that the juvenile justice millage is written on the ballot, that we're also being able to provide community services outwardly.
Yeah, it's for prevention. It does not say that it has to go to outside agencies specifically. It has to be used for prevention.
And that's a
services.
5-year renewal cycle, correct?
Yes,
Okay. When is that up?
2028.
Okay, so we still have a couple years.
Mhm.
Thank you.
You're welcome.
have a question mostly for Connie. I don't understand exactly why this is an agenda item. I mean, is there a decision that needs to be made, or are we doing something terribly different?
Well, the final decision would be at Ways and Means, but if this body wanted to recommend a Ways and Means that we put an RFP out, we could do that. So that would be the request. You either recommend to put an RFP out, or we don't do any programs and keep the programs running that are in the youth facility. Because again, we have budgetary issues, and we have an expansion of our facility, which it's more kids, more prevention services. So that's what we would be looking for.
And we're not required to do an RFP of any kind?
We're not required to, no. I mean, we will contact CMH and Eaton Risa for their budgetary request to run that program.
Do we have to do something now? Do we need a motion for something now, or?
I mean,
We're getting into the budget process. So again, if this body, which again, this is the one that makes policy. So if you feel that it's better to do an RFP to outside agencies to fund services, you can do that. But Ways and Means would then receive those RFPs and approve or not approve them. And I'll tell you, my recommendation, again, is for us to utilize the internal services that we have, especially given the budget crisis that we're in.
My question is, do we need to, if we all agree with that, do we need to have a vote and a motion for that today?
No, you don't have to.
Okay.
When we first, the reason I just want to see how we're operating it is because when it first started, we did do RFPs.
Yes.
And we did have select community, small programs in those communities receive funds to run programs, like after-school programs and things like that, Eaton Rapids and Grand Lodge and things like that. So my concern is how we're spending this. And I understand we have, and that's very good, that we got the state money to do the expansion and things like that. And I did know that for years, we've had the community-based treatment program shut down because of staffing and things. I guess that's just my concern.
I understand that.
I agree with Commissioner Proright that, you know, like, it would've been nice to have them come in here.
We can do that to
Well, I
have
mean,
the
just
facility come in,
to go to
yes.
that point is like, hey, we would prefer to go third party, or we would prefer, you know, like, just to get them to say something.
Well, I don't want to speak for the court. Our court administrator is here, but this is the discussion that we had last year.
Yeah.
And I believe if Amy Etzel would like to get up and speak, that would be the same recommendation from the court.
To stay in-house? Okay. I mean, that seems like where we was leading towards anyways, but.
Yeah, I'm just concerned of having everything centralized in July. That was how things are going.
You're concerned about us controlling it, or?
Well, by not placing things that are close by for youth in their own communities. Because that's the way originally it was. And I know because I was writing the letters to the editor. So, when we need it renewed. But I'm good, because thing is I haven't seen with the expansion, how we're gonna fill it, how we're gonna fund it, how we're gonna service our staff, and, you know, I mean, seriously, I'm willing to go down the road to see how it works. Millage is up on the 28th. 2028, I get it. Thank you.
Okay. Yes, Commissioner.
I guess depending on how the rest of the board feels about it, and depending on staff ability, I wouldn't mind seeing like a super short comparison of how the options differ in terms if we were to do it in-house and what kind of opportunities does it bring us either way. I too would say I'd personally lean toward in-house, but you know, I'd like a little bit more information. Like I'm just like looking for like a one page, like why would we go with one or the other?
I can have, it would be the court, court administrator, do you want to get up and talk? Judge Pollard can come and talk, and obviously Jeremy Mulvaney, who runs the facility and all of the programs.
I'm not going to give a big presentation. I'll defer to Judge Pollard and Jeremy Mulvaney, the director, but just to speak with regards to some of the RFPs that historically we've entertained, those and the millage funds have not always gone to programming that the youth facility youth would utilize. So I want to make sure that's clear, that there have been a lot of times I think Parent and Young Child was a program that, that's not a program that youth in the facility would participate in. That's simply a prevention program that is within the community that's available. And so I think the discussion that we had last year was utilizing millage funds to support the programming that we do within the youth facility and the day treatment program to eliminate the cost to the general fund. So I hope that makes sense a little bit. Connie, I know you.
No, it does, but we can have them come in next month to give a report, to talk about the programs that they have and what they do.
Thank you.
So I would like to ask the board, is that something that we would prefer? That we have them come in? I mean, because obviously we're not against a hard deadline here.
No, we have until September 30,
Yeah.
and we could send out RFPs and accept those at any time before then.
Sure.
I feel like, is this really something that we need to spend a lot of time talking about? Only because the workload that they have, we're putting something else on staff that, is going to add time when they have plenty of other things to do. I'm not saying I don't agree with Jacob, but I'm just saying, be careful about asking staff to do a bunch of additional things in the state that they're in right now.
Would it be helpful to know who the RFPs would be going to?
All right, so, so to move forward, right, I guess, say again?
You should decide.
Yeah, I gotcha. I think I personally would like them to come in, just a quick one pager. Yeah. They do it next month, since this is the first time, like, we're seeing this, and the court, they already said they sort of prefer not sending RFPs out, but I just think, I would feel more comfortable if I seen just a little one pager and maybe them come in and we could front load them, like if we were concerned about their time here, we could put them towards the front of the agenda
We can do that.
and then get them in and get them out, and then that way we have a month to see the material. Okay? So I think that's what we're gonna do. All right, moving on to 12, miscellaneous.
We do not have any miscellaneous?
All right, then we're back to public comments. Oh, yes, sorry about that.
I just have a question relating to, this is more directed at Connie from the earlier landfill report. Their next sampling is going to be in September of 2025. Will they come back and report the results of that?
Yes.
Okay, thank you. That's all I wanted to know. I'd just like to have them back in.
They report twice a year on a consistent basis.
Already. I just want to make sure that we have a very close eye on if it ever does expand outside the boundaries of the property, so.
Okay. All right, we're on to public comments. Yes, come to the.
I just wanted to thank you for approving the grant amendment. We're really excited about this project and moving it forward. And also the partnership we have with Resource Recovery on our recycling. We're starting our weekly recycling on April 7th, and we're excited about that project as well. So really appreciate you partnering with the city on and so many avenues, and look forward to continued working with you. Thank you.
Thank you. All right, any other public comment? Okay, then. Adjourn. 10:50.